Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we have an interview that bridges the two worlds of emergency care.
Yes, we do. And so often we are acting as the first people and the first responders to be on the scene when an athlete goes down or a patient goes down. But who do we transfer care to? And today we're talking to someone who lives the best of both worlds.
Yeah, so we are going to be interviewing Marc Wysocki. He currently serves as the head athletic trainer and associate director of campus safety at Berkshire School in Sheffield, Massachusetts. He also serves as a captain for the Sheffield Volunteer Fire Department. He is a certified EMT and tactical emergency casualty care specialist. And he recently completed his doctorate of athletic training at Moravian.
So we were talking to him originally because we put out on our Instagram, we put out talking about, I don't remember how we originally started talking about it, but we talked about wilderness medicine and like search and rescue. Oh, you know what? Probably because we saw some search and rescue. So we, that's something that we are very outdoorsy and like very much appreciate the search and rescue. And
absolutely.
So I think just talking about that and how it's like a world so far away, but also not that far.
Yeah.
And so we got to talking to Marc, and it's something that, man, I wish we would have asked him in the episode. I totally forgot. But then him talking about the two worlds and how he lives both these, it was really fascinating.
Yes, absolutely. And the one thing too is, and you'll hear it, is just listening to the passion he has.
So we were really lucky to have him on. So without further ado, let's hear from Marc.
All right. So every interview, we got to start with some cryo breakers. Okay. Our first one for you is, what athletic training tool describes you as a clinician? This could be a tape, brace, rehab, etc. Basically anything.
I'm going to go with the Leatherman, the multi-tool. Ooh. Yeah. Because you go from being an athletic trainer to being a psychologist sometimes, equipment manager. Just sometimes you got to be the parent when they're not, when the parents aren't there. So yeah, I think the Leatherman fits me best.
That's really cool. Have you used the Leatherman in both settings or mostly as an athletic trainer?
I have different tools in my pocket in my bunker gear for that stuff, that it's just quicker instead of trying to look through different tools. So yeah, I have multiple tools to replace that one.
Yeah, I can imagine.
Speed and time is what we want.
That's true.
Yeah.
So speaking of that, let's kick this off. I keep trying to say athletic training chat. That is not our podcast. Here at AT Corner, we like to kick these story episodes off, or these interview episodes off, with a story as we pair this evidence and experience topic. Would you be able to link or share us a story about your role as an athletic trainer and a first responder?
Sure. Like how I got to that point, or my origin? Like, what would you like?
That sounds good to me.
Yeah.
All right. I'll start with the origin story. So way back in the 1980s, kids are going to have to look that up. That's history. I was playing football, and little sophomore made it through. We had 2 weeks of double sessions. This was way back before everything was regulated. You just did it. You had Sundays off. You did session in the morning, had lunch, had a session in the afternoon. That's just what it was. And basically a tackling dummy for the varsity team is what it felt like. But I made it through. I made it through every session. And then the first practice after school, first tackling drill, tore my ACL.
Oh no.
5 yards apart, we slammed into each other. I didn't hear or feel anything because you just hear the pads pop. And I remember falling on my side, my coach saying, "Hey, do this and this next time." I was like, all right. I tried to get up, and that was it. I had to be carried off the field. And then back then, so just going off the top, for surgery, I was in a full plaster cast,
Wow.
crutches. This is the 80s. You got to remember this, research and all that hasn't come along. And they actually use my IT band as my ACL.
Oh, wow.
Oh, wow.
So they stapled it in. Yeah. They stripped the middle 1/3 and put it in there. And obviously rehab was a lot slower. I also slammed my femur into the top of my tibia, so I gave it a good crack there as well. So, so football was done for me. Not like today where, I'll go back next season. Fortunately, my football coach is also my guidance counselor, and he knew that I got really interested in the PTs and the ATs in my clinic, and they let me shadow them after I got discharged. And
awesome.
Kramer used to have student workshops around the country. So I went to one to Northeastern that he got the school to pay for when I was a junior. And that what lit the fire. It also helped that it had 3 future Hall of Famers there. Chad Starkey, Paul Grace, and Coco Kasabian. They were all at Northeastern doing this.
Wow.
So, I think I still have the piece of paper somewhere.
Oh my gosh.
Autograph. Yeah. So I was very lucky. Like when I look back, I'm like, why do those names sound so familiar? And I looked on the piece of paper, I'm like, oh my God, they helped start my spark. And then I haven't changed since. I loved it. They lit the fire underneath me. So I was very fortunate. I went on to get my bachelor's at Colby Sawyer College in New Hampshire, and then my master's at Springfield. And fast forward 35 years later, just finished my doctorates at Moravian. So I've been, very fortunate and very passionate about this. To go on to how first responder all tied in, it actually goes to the school I work at, Berkshire School, which is a private prep school in Southwestern Mass. It's a co-ed school. They live here. There's about 400 students. And at the time, we had a head of school, and he was very passionate about community service, about, we can't just be this school in the bubble, that we're different from the rest of the town. And that really resonated with me. And then later that year, I got a pamphlet in the mail and about the local ambulance squad having an EMT class. And I went ahead and took it. It was 4 months, 2 nights a week, and then 1 Saturday a month. And so that's what helped spark me. I joined that ambulance squad. We have a private ambulance squad. It's not part of the fire department here in our local area. And so I did that. I was with them for 12 years. I did Monday night shifts, 6 p.m. to 6 a.m. And then Tuesday morning, got back to work. Very well caffeinated, not going to lie. Yeah, Tuesdays were a little rough.
This is after you've become an athletic trainer?
Yes. Oh, yeah. It's well after I become an athletic trainer. And then about 3 years into being EMT, I joined our fire department, which is volunteer. Yeah, we practice once a week. And I worked my way up from firefighter to lieutenant to captain.
Wow.
Wow. That's so cool.
Thank you.
So did they approach you about becoming a volunteer firefighter, or is that something that you sought out?
That was all on my own. Yeah. I just was just looking for that next challenge. So one thing that's always been a motto to me is always learning. And I did a talk a couple of years ago at Springfield College, and I told them I personally have like an athlete mindset. So once we get like to the spring and our seasons are winding down for athletic trainers, that's what I consider my preseason. I look at continuing education, like how do I set up, it may not be athletic training, it could be firefighting, or just me personally, just something I need to work on.
Yeah.
And then using that summer to get better. Just like I just looking out at this student, that's me, like, just like you get better in the off season. You don't get better during the season. That's too late. You
Yeah.
got to
Right.
work on the off time to get better.
Man, how did you balance that, like just those two worlds of doing like that 6 to 6 shift and then also having to work as an athletic trainer?
Oh, yeah, there was definitely a sleep debt the next day or two. I'm not going to
Mhm.
lie. Yeah. Some mornings I came in a little later to work on
Mhm.
Tuesdays. Absolutely. When the night was brutal, or
Mhm.
there were times I didn't sleep during my shift. I
Mm.
just
Yeah.
couldn't. And excuse me, just got my way through it, and then crashed Tuesday as soon as I was done with work. But yeah, it's definitely a balance. I didn't get into the EMT shifts until I had a good handle on my job
Mhm.
and what would work in
Okay.
my environment.
That's really cool that your employer at the time too it seems like they were pretty supportive of that.
Yes, definitely. So what also helped was back. So this is early 2000s.
Mhm.
Our football officials required an EMT on the sideline. Now, our
Oh,
Berkshire
interesting.
County is pretty rural. There's not a lot of athletic trainers.
Mm-hmm.
Mm.
So there's like me and my coworker in our school. There's one in another prep school up north, and then we have one college in the area, and that's it. Oh, and sorry, two colleges, and that's about
Mm.
it. So, and the rest are EMT. So, but it took a little time, took a little talking to the person who runs the officials, and also it helped that more of his guys did college games,
Okay.
outside of our county. So that really helped. So that
Mm-hmm.
eased off. They took that away, and they added an athletic trainer.
Oh, good.
Oh,
That's
that's
awesome.
awesome.
That took a few years though, but still, I did that also kind of help our school out, so they're not shelling out money.
Yeah,
Yeah.
It was a win-win.
for sure. Absolutely.
Did you notice how your athletic training background transitioned you into becoming a first responder?
Yeah, it definitely helped parts on the EMT side, especially musculoskeletal
Mm-hmm.
Mm.
concussion, splinting. And a couple of paramedics already knew what athletic trainers did.
Oh,
Oh,
that's
I
good.
don't know
awesome.
how, I forgot to ask them, but like if we went on a call that was really musculoskeletal, they let me kind of lead
Mm-hmm.
until they had to take over, when it became an ALS call,
Mm-hmm.
like when their bone is not where it's supposed to be,
Yeah. Uh-huh.
and it's like, it's okay. You take over, you give them the medicine and let's get
Yeah.
going.
Uh-huh.
But yeah, some of the simpler stuff, they let me kind of lead until they had to, do
Mhm.
their thing. So that was good. And I also did talks when we had training nights uh, of concussions, musculoskeletal injuries, splinting, because a lot of them did per diem, like covering youth sports,
Oh,
Mhm.
okay.
to kind of give them a better background of what to look out for.
Wow, that's really cool. That's
Yeah.
awesome.
But also, like, there was plenty of other stuff that I wasn't prepared for. Obviously, you get trained, but like seeing pediatric calls. And I don't mean
Mhm.
adolescent, teenage. I mean like the little babies, or doing CPR on a 90-year-old person. Stuff, the other ends that we don't see as an athletic
Mm-hmm.
trainer.
Wow. Yeah, I can imagine that, yeah, not having that preparation, you don't see that all the time as often as they do.
Exactly. Yeah, that's another Tuesday for them,
Yeah.
for sure.
So
But it
you were
definitely
saying
it definitely helped me overall, as a healthcare professional, seeing the entire spectrum of emergencies.
so that's what we were going to ask as well is what have you noticed since you've become an emergency responder? How has that improved you as an athletic trainer in your practice?
Oh, my EAPs, chef's kiss. They're really, I really think about the worst situation and work backwards.
Mm-hmm.
Because I've
Yeah.
seen a lot of that stuff. And when I look out at my campus, I go, all right, worst word, I can see where the helicopter can land if needed.
Mhm.
And then, what resources can come by what time, whether it be fire, police, EMS, and knowing, you know, if our town is busy, who's coming next and so forth. So, I mean, that's really helped me knowing our local resources and, if they need to come onto campus for whatever reason, even if it's just, I need an ambulance for whatever reason, I know that I can feel the clock in my head. All right, I just called them. I know how far they're away. If hopefully they're in the ambulance bay sitting there, and how long it takes to get there. Because, when you call, it feels like hours.
Right.
You got the adrenaline pumping. But I think that's definitely helped calm me down as well.
Oh, that's awesome.
Taking care of the person. I'll just keep doing vitals, keeping them stable, just like the stuff we know until they get there.
So this is actually, I just recently sent our updated emergency action plans to our EMS coordinator.
Yes.
And so they have a copy of them, but how accessible are those to them in an emergency? Do they have those? I mean, I know it's going to be different per place and their policies, but is that helpful for you guys to have a copy of the EAPs?
They don't have our EAPs. We just have, whether it be us as the athletic trainers, and if the fire department or police come, they're acting as first responders, and then we all agree we're handing it over to the ambulance when they come.
I mean, as far as like maps and directions.
They're very familiar with our campus.
They've
been there, many times. We also have a health center where we have nurses 24/7 and a doctor during the day. So awesome. They've come to our health center many times, and so they've been on campus throughout. And then we also have campus safety. So we always call them when we call 911, so they can lead them in if it's not a usual spot they go to.
Okay.
So we definitely have layers built in for sure.
Yeah, that makes sense. Yeah, our campus safety has been pretty great about helping get EMS to us.
Yeah, we just call them, say, hey, I just called. Can you wait at the driveway and lead them in? And they're like, yep, no problem.
From that experience as being on the emergency side of it, what do you think has helped? Like, how has that helped develop your EAPs? Like, what one thing that you're like, oh, as an emergency responder, this is what I would need to know in our EAP?
I think a couple things. I think it helps having those conversations with your ambulance crew, fire department, whoever it is, knowing what equipment they have.
Okay.
And what you have. Just easier transition. Like I've switched to scoop stretchers, and I mean, we have eye gels and OPAs, but it's the same stuff they have.
Okay.
So if stuff's like spread out of my bag, or they need something out of their bag, it's just trying to make that transition easier as possible. I think that's a big thing, and just having that communication is what helps us, sitting down with whoever the point person is on the EMS fire side in your town, and just having that conversation, I think, helps your EAPs as well. And then, just knowing their shifts and how they're staffed. So if you just say you had an emergency at 4:00, but shift change is at 3:30 or 3:45, you're like, oh, okay, at least I know that if there's a stall, pause, why it took them so long. I'm just throwing that out there for a time. Yeah. But, just knowing the nuances of their side as well, I think helps the front side of planning your EAPs as well, or just knowing little things that help them transition quicker in getting that patient to the hospital.
Yeah, it sounds like it boils down to just communication, just having good communication with the local EMS. That's awesome.
Yeah, that's what actually started before I became an EMT. It was just me literally knocking on their door and just getting one of their higher ups to come out to see my facility. and just showing them and explaining what an athletic trainer is and what I have and how I can help them if we once we call them onto campus for a sports injury, what's going to happen.
Is there a way that we can make it easier for the EMS other than getting, like, for example, campus safety to direct them? Is there a way that we can make it easier for directions on the phone, or ways that we can kind of communicate better for them to know what's going on before they arrive?
I would say laminated maps,
Mm-hmm.
just giving them a good stack, the
Mm-hmm.
police and fire EMS, just so they can have it right in their rigs of the entire campus, or maybe or put it on a binder ring and just fields if they're named of whatever high school. I think that would help too. Just making it very simple. The KISS principle, keep it simple. That's, because when they hear a high school and a teenager, that's not a normal call for EMS. You get a healthy individual and something's really wrong.
Yeah.
They're going to get there, So I think just any way you can keep the communication simple, straightforward, and an easy grab like that will be very helpful.
To piggyback on that one, what about when the transition of care? Is there anything that we can do to make that as smooth as possible for EMS, or to help just make it kind of that transition nice and smooth?
Obviously just given the history, what happened, the mechanism, whatever it is, your vitals, if you took them a couple times or, just once, whatever, any interventions you did, oxygen, OPA, whatever it may be, just so they're aware of it. And if by chance, the person's personal history, if they're alert and conscious, you can ask them about any meds they're taking, any allergies, just in case they have to do any medical interventions. It would just help them in the long run. They may ask them again just because it's built into their DNA. It doesn't mean they don't respect you or, they're stepping over you. It's just they have their own process. They just spit it out without even thinking twice. So,
I mean, it's also good to check. It's also good to check.
Yeah, it is. Like you may have asked something, and then if they ask it and it's a totally different answer, and you just lean over and go, that's not what they said. So that happened plenty of times too. You look at them like, wait, I just asked you that and you said something different. But yeah, don't take it as an offense or, they're stepping over you. It's just, just like we have our checklist in our head, they have it in their head as well.
That's awesome. That's really cool.
Yeah.
So you talked about earlier how some paramedics knew about athletic trainers. Did any of the other EMTs or any other emergency responders kind of already have an understanding of what an athletic trainer was?
Not really. I think the presentations definitely helped.
Good.
Getting in front and the paramedic got up there and he said, Mark's got, experience at Berkshire School. This is his job. So we're going to let him talk about, what his expertise is. I just gave him a brief, explanation and then went into whatever presentation I was doing.
How receptive, for the ones that weren't familiar with an athletic trainer, how receptive were they to you as with your expertise?
Yeah, they were pretty receptive. I mean, they were thankful, especially for the ones that, like I said, do per diem for youth sports, just giving them, more knowledge in their toolkit, just to be a little, more knowledgeable of musculoskeletal injuries, of what's going on, shoulder, ankle, knee, whatever it may be. Obviously, they're still going to do their basics, hand them off to the parent, and go from there. But I think just being a little more comfortable with those situations too, especially I would say with concussions too, and youth sports. I think that's where they felt more thankful that I gave them that information.
That's awesome.
Yeah. Because when they're dealing with concussion, that's like motor vehicle accidents or,
Oh, right.
Oh, I didn't think of that.
Something a little more violent, shall we say.
Yeah.
So just like when you're talking about an EMT and giving them these tools for their toolkit, would you ever think it's appropriate for an athletic trainer to have in their toolkit something like an ALS or more advanced?
I mean, if they want to become an AEMT or paramedic, that's fine. But it's also, what the state allows. That's the other juggling act. So, like for Massachusetts, you have to be part of an ambulance service to be able to be an EMT, be a paramedic. You just can't go out there and freelance, shall we say. That makes sense. Yeah, California. Sorry. That gets me too about the whole AT thing, but that's another conversation. But yeah, that would really depend on the state practices and what they allow.
That's not the first time that we've heard like the EMS kind of setup at California is a little wonky, because we were talking to someone in Texas and they were like, yeah, we don't know how you guys get anything done out there.
Yeah, I know. It's a political battle. I have to admit it. Massachusetts is pretty on top of their game with athletic training. I mean, even when I went to grad school back in the 90s, we already had licensure.
Oh, wow.
That's awesome.
Yeah. I mean, that's when I first learned about it. I mean, I heard about it undergrad and like, yeah, whatever, just write it down, get ready for the quiz. But yeah, getting out in grad school and then, supervising undergrads, I really learned more about the legal end as well. And Mass was already set up by then.
That's awesome.
Yeah, it really helped.
So with that education piece, what advice would you give an athletic trainer on educating on how they should help educate emergency responders about what an athletic trainer is, what we do?
I would use just like, we're here to help. We're not here to step on you. We're here just like you are for patient care. We just happen to be there when it happens, which is, I would consider that of an advantage for them instead of just Joe Public standing around. What do we do? We just want to help and then, hand off to a higher level of care. We're there to help. We want to help the athlete. We want to help you, even if it helps just doing a rig tour, looking through an ambulance. Like, they're usually 2-person crew, if it's something bad, maybe you could help them out grabbing the stretcher. I mean, that's what we do in a fire department. One of our practices, like the ambulance comes down, we look through it. So we know where like their backboards are and their stretchers and whatever else, they're pretty good about labeling the rigs on the inside. So, if they ask for something, it's pretty upfront. But that could help too, just knowing where things are just to help. But I think overall it goes, we're there to help. Obviously explaining your role and, what I'm allowed to do with whether it be airways, CPR, putting on splints, whatever it may be. I think just giving them that knowledge and knowing that we're there to help and we have a great set of tools, to help whoever we're with.
Have you ever been part of a day that you have gone as a first responder to an athletic trainer's school, or as you as an athletic trainer have had EMS come to you and kind of done like an emergency scenario day?
I have not had that. I've done MCIs, but as part of the fire department or as part of the ambulance. It was all first responder.
What is an MCI?
Oh, mass casualty incident.
Oh, okay.
So we've done school shootings, gas leak, chemical spill, things like that, where we have multiple agencies work together, just practicing. That really happened.
So we just, for the first time, we've been trying to get this in the works, but for the first time, we've actually had EMS and campus safety and our athletic trainers all together on one campus this last season.
That's awesome.
And it was our trial run. We had some ideas of kind of how we wanted it to go, but we definitely have some ways that we want to change it in the future, so that we can, practice some more things. Are there any things that you, as a first responder / AT, would want to see at a day like that where we collaborate? Like, would you prefer like emergency scenarios, or talking about, like, for example, one of the things that we talked about was heat illness. Do you want us, like, what our policy is? Splinting. Do you want us to splint? Are you going to splint? Like, stuff like that.
Yeah, no, those two are great. I think if you can just at least do tabletop exercises, if you could just put like the map of your high school down, and maybe just think of stuff on the spot. You may even need someone from maintenance too. The power goes down, or, the Wi-Fi, or, something, you're not thinking, obviously we're thinking about heat and lightning and whatever weather-wise or orthopedic injuries, but other things happen on campus that can cause a ripple effect too. I think just having those tabletop exercises as well. Maybe make sure there's look for any tough spots that rigs or the engine may need to get into, and how can we help, avoid that if possible. Like you've got the typical 5, 6, 7 home games, and you got cars spread out everywhere.
Yeah.
You make sure there's no park zones. Like I have one near my football field that our maintenance department, I give them the dates, they block it off.
That's awesome.
No one parks in that parking lot because it's direct access right onto the field. Little things like that, I think you might have to get with, your grounds department, whoever, or maybe just athletics setting out cones the morning of, it just to help with that.
It just boils back down to logistics
and communication.
Exactly. Yep. But yeah, I think if you can do a few tabletop exercises, I think that would definitely help.
That's awesome. That's cool.
Yep.
All right.
You ready for the action item?
I think it's time for some action.
All right.
What would you like ATs to know about emergency responders?
A couple things. They're human like us. I know some people I've said this before, they want the superhero Olympic neuroscientist to show up and save the day. But, you're going to get, the 3 or 4 guys off the engine who this may be their 7th or 8th call of the day, and they're going to do their best. So just like we ask patients, we ask our, teenagers to be patient, and other people, especially when you feel like it's been hours, but they're 7 minutes away or whatever, it's being the patients, working together, just communicating. I'd say also don't, like I said, they're not trying to step on you. They have their own stuff that they have to do through their, procedures and checklists. So they're not trying to step on you or, push you out of the way, but they also have to do their things, just like we have to do our paperwork to cover our butt. So you may feel like, oh, that was a paramedic being a god pushing me aside. Well, you know what? They may, first of all, they're at a higher level care. So you got to give them some room, and they have to do their things as well, because they have to document what they did, because that's what the state requires of them. So that I think those are some of the things just to remember when they get to the scene. It might be our one call of the day. It might be their 7th or 8th already.
For sure. That's good.
Also recognizing if a first responder isn't familiar with an athletic trainer, it's very difficult for them to find that trust as well. Like the same as if you're on the field, and if a random nurse or other healthcare professional runs down into the space that you're evaluating. Like it's a very similar situation that we see very differently when we're the opposite side.
Yeah, when you're dealing with a dislocated shoulder and the doctor's an ophthalmologist.
Right. I mean, at least we're better off than that.
Yeah, but I think you do have to be a little assertive on the scene, bordering on jerk. I'm going to be honest.
Yeah,
you got to control your scene.
Yeah,
or hopefully you have an administrator or administrators that can help you. Part of your EAPs, like I need you for crowd control.
Yeah.
Mm-hmm.
That's probably where your AD or your principal can come in real handy.
Yeah.
Please, you trust me to take care of them day in, day out. Let me do my thing when the stuff really hits the fan.
Mm-hmm.
But if I need more people, I will definitely let you know.
Yeah.
I did want to ask you actually one more thing. I probably should have asked at the beginning, but I think throughout this I was realizing I actually don't really know the nuances of a volunteer firefighter. So can you talk about the differences between like an EMT and a volunteer firefighter?
Sure. So I'll just give you where I live. Our ambulance service is a private. They're not part of the fire department.
Mm-hmm.
So they cover a lot of towns. So they're 24/7. Hopefully they have at least 2 crews on each shift.
Mm-hmm.
A couple paramedics, a couple EMTs. The towns around us are volunteer. So we all have a pager on our hip. And then our town has called I Am Responding, which is an app, which is hooked to our dispatch. So if a 911 calls in, our phone will go off, and then it'll be whatever the dispatcher says electronically sent to our phone. So in case our pager doesn't have good signal, we can at least hear, where and when the emergency is. And then, we go when we can. We respond on the phone. So it shows at dispatch and it shows in our fire station who's coming and how far out they are. So that's what we just go when we can, whether it be medical or fire. And if it's a medical, we get paged and the ambulance simultaneously. It's never just us. So that for the medical, it's always our ambulance and then us. So we can help out wherever in town we're needed.
Oh, that's awesome. That's cool.
Yeah, that is really cool.
Yeah.
And then we also rely on the other towns for mutual aid too, if it gets really bad.
Okay. Wow, that's interesting. That's cool.
Yeah.
I feel like that should be more common knowledge.
Yeah.
Is that like that in more areas than just like rural areas?
The volunteer?
Yeah.
There's more volunteer than actually paid firefighters in this country.
Oh,
really?
Interesting.
Yeah.
Wow.
Definitely or they're paid per call, but it's still, it's not their job.
Yeah.
Right.
For sure. Yeah.
Wow, what an interesting stat.
Yeah.
Well, that's really cool. Well, thank you so much, Mark.
Yeah, this was awesome.
Yeah. Yeah, I'm glad. I really enjoyed this. This is great.
One thing I'd like to revisit from that episode was the fact that he just dropped with us at the end there, how there are more volunteer firefighters than paid firefighters.
That's a crazy stat. I still think that's a crazy stat.
Also, I think I need to dive into this a little bit more. Like I feel a little bit uneducated on this, but what I'm picturing is like people get this like page and or this message and they are in their normal car, normal clothes, and it's kind of like a flash mob of just like whoever can.
It's the bat call.
Yeah, exactly. So I'm wondering, because like I've never seen any I mean, I also am not in a very rural area, so like I haven't seen just a random person in a random car respond. I think it's really cool and very much needed. But I was wondering about that aspect of it, of how that might change like respect or trust. With the uniform comes a little bit of authority and a little bit of I don't want to say safety, but like a little bit
comfort.
Of comfort for the person who's being tended to.
Yeah. I really liked hearing the insight from that other side, and like how it's helped Mark's practice, and how his EAPs are, as he would say, chef's kiss.
Yeah, that's really cool. I mean, usually like we use campus safety to do all the directions and directing EMS. So, I mean, if he's part of both, I mean, I can understand how that really helps play a big role.
Yeah.
Because, I mean, we always talk about this here on AT Corner and in real life. Like, we just don't know another role until you you don't know the ins and outs of it. You can see it from the outside.
Yeah.
People see us from the outside and they still don't know exactly what we do. I don't think a coach has ever seen me fill out an insurance claim form or ever seen me call the insurance
or set up the appointment
or ever seen me converse with the doctor about differentials, or, you know, there's so many things in like the ins and outs that they might hear about and we might reference, but they don't know because they're not in our shoes. And same thing, like we don't know the ins and outs of these other of first responders and what they see if this is their 7th, 8th call of the day.
That was a good point too. Like that is probably our first like quote unquote call, and that's probably their 7th or 8th.
Right.
So that was a good point. That was a good perspective.
I was just recently talking to my EMS coordinator about ambulance ride-alongs, and that's totally something that eventually I'd like to.
You have talked about that for a long time too.
Yeah, I think it'd just be so helpful in like understanding their world a little bit more.
Yeah, for sure.
So here on AT Corner, we don't just do interview episodes like this. We also do CEUs and we do story episodes. So for our CEUs, Randy reads plenty of research articles. I think the last one, you had 99 references available.
Yes.
But I think, what would you say that you actually used for the, so 30 research articles Randy used for the patellar tendinopathy episode, which is super awesome. You don't have to read all those research articles. You can just listen in as we kind of dissect them. Randy brings in, the main topics of what he's read, and we kind of bring it to real practice. And they're available for CUs. Thank you so much to Athletic Training Chat and Clinically Pressed. So make sure you check those out. We also have story episodes that I had, and those are stories from athletic trainers from around the world about a highlight topic. Our next one will be imposter syndrome, which we are super excited about, a listener request. And we just got so many good ones that we are so excited to share because it's something that I think was a lot more common than I thought. So we have those. Make sure you check out the rest of the topics available. And I think that's all I have.
Perfect. Thank you for helping us showcase athletic training behind the tape. Bye.